from the Bay starts now.
And a nice warm welcome to The View from the Bay on this Tuesday, January 15th. I'm Spencer Christian.
And I am Lisa Quinn in for Janelle Wang.
Still resting her vocal cords, but getting better, and we'll be back soon.
Yay.
We want to welcome everyone who's watching us online, by the way, as we are streamed live by our friends at Comcast. So you can watch us anywhere in the whole wide world, as long as you have access to the worldwide
Doesn't everybody have access?
The web, the www. Easy for me to say, right? Wide world of the web. Really cool. Okay, how good dental hygiene can extend your life and improve your health. That's next. Did you know your mouth is the gateway to a healthy body? In fact, many diseases can be traced directly to the mouth. Joining us now with tips on improving our health by taking care of our teeth and gums is Dr. Andre Azarinfar of the Embarcadero Dental right here in San Francisco. Great to have you with us.
It's a pleasure to be here.
Such an important topic. Tell us how our dental health is connected to our overall health.
As you mentioned, the mouth is the gateway to the rest of the body. The head is connected to the rest of the body. Whatever happens in the head could affect other part of the body, and vice versa. With the knowledge that we have today, we know there is a connection between gum disease, heart attack, stroke, and pregnancy-related problems.
And all of these can be connected to poor dental health or poor oral health?
It could be, because the bacteria that they found in the gum disease, they found them also in the plaque in the arteries.
Exactly.
So many people think that going to the dentist is not important, and this is really proof positive that it's not just that you might have a cavity. It's a lot worse than that.
Exactly. It's more than a cavity and having the teeth cleaned.
Well, let's talk about some of the conditions that might actually be connected to dental health. One is headaches.
Yes.
What are the statistics on that?
About 78% of adult female and 68% of adult male, they're suffering from unspecified headaches. The unspecified headaches are likely related to muscular dysfunction. As you see on this skull, human skull, the muscles that they are at the opener and closer of the jaw, they could be inflamed due to overload. For instance, if the bite is a bad bite, the teeth, they don't mesh correctly, they could put an overload on the muscles, and the muscle could get inflamed and could cause tension headaches.
And can that be solved with maybe braces?
Braces or restorative adjustment of the bite, or night guard or splint.
And I would guess it's possible that many people have bad bite and don't even realize it.
Exactly.
Right?
About 75% of the American, they have bad bite, but about 35% they require treatment.
Okay. Now, there's also, you said there could be signs of cancer through oral.
Yes, oral cancers accounts for 3% of the overall cancer, and about 41,000 cancer cases, they were diagnosed during 2006. Out of those, about 4,500 that caused death. You can see signs of the cancer by going to dentist. Oral screening, cancer screening is part of the examination that the dental hygienist and dentist should do that.
So that's standard, you don't have to ask for that extra?
No, that's part, that's the requirement, that's the standard of care.
I think many of us assume that when someone has a great smile, a perfect smile, that indicates good dental health, but that's not necessarily the truth.
No, the dentists today, they are the physician of the mouth and beyond. Basically, you go to a dentist, there are a lot of other things that the dentists have to look for, and they have to develop the competency and knowledge in order to diagnose those problems.
We even have a photo here of someone who is incredibly famous for her smile, and you're saying that there's some problems here that you noticed.
Yeah, Julia Roberts, as you can see, the teeth, the bite looks fine, but the gums, they look red and a little bit inflamed on the upper right. You can see that. I don't know if the audience could see that.
No, I think we can tell what you're talking about, yes. Now, here's another celebrity photo, and this is Jennifer Aniston, and what do you see here? This is good bite, I guess.
Yes, absolutely. She seems to have a healthy smile and healthy mouth.
And let's go to George Clooney, a very well-known smile there. What do you see signs of in his smile?
Signs of bad bite. The teeth seems to be worn out and I can see early signs of a bad bite.
Okay, so when you have bad bite, you have a device here that shows us.
This is a jaw simulator, which is showing the ideal bite, basically how the teeth they mesh together.
Right.
And if you don't have the proper overbite, if the back teeth they are not sharp, they could cause symptoms such as sensitivity, mobility of the teeth. The teeth they could become loose, and this could cause headaches in most of the cases.
So I guess the key here is pay attention to your oral and dental health. Get regular dental checkups.
Get to a dentist.
Yeah.
Yeah, skilled dentists that they know about the bite and could treat the bite.
Dr. Azarinfar, thank you very much.
Pleasure to be here.
Really important topic.